some of our throwing athletes specifically. So what we're going to do right now, we're going to go after kind of those posterior, posterior medial, posterior lateral lunges, those kind of medial kind of lunges with our wood chops, kind of overload some things a little bit more. So we're gonna get set on up here, and what we're gonna do, we're gonna kind of transition from the beginning to the end of that TZ1A. There's continual loadings, continual transition zones throughout any movement. And so what we're gonna do right now, again, take care of the efficiency of that initial load, so that the sequential loads are optimized, so that we get a consistent result. What we're going to do right now, we're going to add our little contralateral wood chop with our leg kick for a throwing athlete. So we're going here. So with this, again, we have femur, pelvis rotating right, thoracic spine, scapula rotating right to give us that relative right rotation. From the top down is loading, so the scapulothoracic junction is, and joints kind of loading, it is loading that hip from the top down. If we're not able to load there, that hip and that foot and ankle are going to bail on out. So here, we have a nice little angle that we're working on. And now we're going to go posterior medial with it. A little posterior medial. We can go with a little kind of preset kind of position. Let's do 3 or 4 kind of preset. And now we're going to add a wood chop. Wood chop with a leg kick. Wood chop with a leg kick. Wood chop with a leg kick. Let's go posterior lateral with it right now. Let's really, with that posterior lateral lunge, get some good frontal plane loading. It really allows us to establish a lot of good momentum, inertia, kind of traveling over that backside kind of rubber and or hip if you are a swinging athlete such as a golfer and hitter as well. So we're going posterior lateral with a wood chop. Let's kind of preset. So we're here and here, here and here. Quarterbacks, we can add kind of our little 3-step drops in place of obviously the pitching mechanics. Just kind of a way for us to kind of play around with some things and show you guys what we're kind of capable of doing. So great to do with our FMR techniques, as you've seen with some of our professional athletes already. Let's add a couple more wood chops. Boom and boom. Really, really feeling a big load in that butt and the back right here. Boom and boom. And now let's add just a little anterior medial kind of lunge with a wood chop, or a little step here, and then up. Little wood chop, and then up. So we're really cranking out the slack in that system. Little wood chop, and up. 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 Great activities to play with. We're going to progress into throwing this guy. We're going to progress into getting a football, getting a baseball glove, getting a baseball bat, and going through the TZ1B, the TZ1C portions of our swing and our throwing or propelling. We were designed to change levels, center of gravity, moving up and down, side to side, outside the base support. We're designed to locomote, get from one place to another. These are all relatively speaking. We're designed to push and pull objects, and we're designed to rotate. I like these activities, kind of preset in the upper extremity, going with a kettlebell, going with a medicine ball, you don't need much weight, going with a dumbbell. Get into some really cool dumbbell activities with this involved, and then going out to the driving range, hitting a bucket of balls with some of these kind of loadings, taking a football, going on out, working on your setup, your 3-step drop, pitchers, outfielders, infielders, taking these loadings and throwing yourself into a position in which you need to make a throw. We need to be able to use the backside hip and the butt. We need to be able to take advantage of optimal functionability and mobility of that scapulothoracic joint, of that thoracic spine, that lumbar spine, that hip. A lot of people look at you like, thoracic spine, what the heck are you talking about? There's a whole big world involved outside of kind of what we would typically think of, just kind of that hip, kind of that push off the rubber. We need to take advantage of using the whole chain and using this sequential kind of chain reaction from the top down.